February that he had entered hospice care at home. His wife joined him in hospice care this month, and she died just 2 days after that.
So their journey together has a lot of people talking about end-of-life care. Here to talk about that is Dr. Todd Ellerin, Deputy Chair of Medicine at South Shore Health. Dr. Great, thank you for joining us. We always appreciate it. President Carter has been in hospice for 8 months now. The question here is that unusual, and Ed and I, unfortunately, we both know we've both been through it, and we know that sometimes that's not unusual.
Right. You both know this. Hospice offers critical end-of-life care with a focus on patient comfort and dignity.
Yes.
Patients enter hospice at different paths and points along that journey. It's obviously very hard to have that initial conversation about end of life, but you really want to consider this when patients have advanced terminal conditions and their life expectancies are less than 6 months, and when the treatments are really no longer working. Is it unusual to be in hospice for 8 months? I mean, that's not the most common thing. Most patients who enter hospice do die within a month, but again, there's plenty of patients that are in hospice for 6 months or more, and if you're in hospice for a 6-month period, then you're reevaluated again to make sure that hospice is for you. Sometimes patients even leave hospice. They're discharged hospice alive, and some of them do well for periods of time, and then sometimes they have to re-enter. So it's a continuum.
So Dr. T, for a person that's entering hospice, what kind of treatment really is available?
Right, I'm glad you asked that. Hospice doesn't mean you're no longer treated. Yes, it's true. You're no longer going to get chemotherapy or radiation for cancer. It's not just about cancer. It may be advanced heart failure or lung disease or dementia, like we were talking about here. But there are treatments. There are treatments for pain. We want to make sure that pain is minimized. Treatments for anxiety or depression, for breathlessness. There's even part of hospice teams, besides nurses and physicians, include social workers that can help with wills and funeral arrangements. There's spiritual care to help sort of face end-of-life issues that are helpful for patients and their families. This is really important. Consider this. Ask about, if you're not sure if your loved one needs hospice, ask if you can have a palliative care consultation. They can be very helpful. These are experts that can help tell you whether hospice is right for you.
And Ed always says this, and I'm going to take your line, these people are angels.
Oh, angels.
They are incredible.